This week, the nation marked 1 million American lives lost to COVID-19. And one of the groups most affected by the virus has been those in nursing homes and care facilities. According to the Centers for Medicare and Medicaid Services data, there now have been over 150,000 resident COVID-19 deaths in nursing homes and care facilities. And according to the CDC, nearly 75% of COVID-19 deaths in the U.S. have been among people over 65. David Lawyer lost his father on March 8, 2020, due to COVID-19. He was a short-term patient at a care center outside of Seattle. And David joins me live now to talk a little bit more about his experience. David, thank you for being here. I'm sure this isn't, easy to talk about. Your father was at this care center after being briefly hospitalized with a urinary tract infection. So what was your reaction when you found out that he then contracted COVID-19?
Well, he was way at the very start of the pandemic, and so nobody that I knew very much about COVID at the time. We'd heard the word, but I didn't know anybody that had contracted it and didn't know much about it. And so it was, something of a surprise, and we didn't know where to turn or what to do. And we know so much more now that the experience, I'm sure, is just as sad, but very different from what we went through.
Now, more than 2 years later, do you feel like there were lessons to be learned from what happened to your father? And do you think those lessons have been learned?
Well, I hope on a macro level that we all realize that, infectious disease can come without notice and that future pandemics are a risk and a possibility. I don't know that the immediate reaction back in March of 2020 could have been much different. Nobody had the tools. There were no treatments. There was no vaccine. There wasn't even a lot of understanding of how the disease spread. And so you just knew that vulnerable people were in a very, very bad situation. And so I suspect, I haven't gone and checked, that nursing homes probably have a lot more procedures in place, not just for COVID, but to battle the eruption of any infectious disease, and they're better equipped to deal with it.
Now, the care center where your father stayed lost more than 36 patients to COVID early in the pandemic, and it was cited and fined by authorities for, in part, failing to properly prevent the virus from spreading. Several families of patients also sued, and we've reached out to the center. We haven't received a response, but you have said that you don't have any hard feelings toward the facility. Why is that?
Well, first of all, it's the newness of it all. I mean, there are regulations that require various procedural steps, and I think people have pounced on that as some kind of causation factor of people getting sick and some of them dying. But, I'm an attorney by profession, and so as I looked at the facts, and number one, and number two, literally looked people in the eye who were really heroes. They were marching into danger, trying their best to care for and to protect people, and they had no understanding of this disease and no alternatives available to them. Even something as simple as testing was not available to the facility back in March of 2020. Tests were rare, hard to come by, and they were controlled by the CDC, not by the facility. And so, you put yourself back in March of 2020, and it's very difficult, in my mind, to come to any conclusion that the facility made significant blunders in caring for the patients that they had on site.
So what's your message for viewers watching about COVID-19, about your experience and what happened with your father? What do you want people to know?
Well, at the very beginning of his career, my father was a research scientist. He worked in a lab looking for a cure for cancer. And of course, all these many years later, we don't have it. But I think, to illuminate this experience of this pandemic, it's really important to, number one, support and champion the causes of those who are on the front lines battling the disease, and to kind of praise the federal government for its response in putting together a vaccine in record time, And then the messaging, which has been, sort of up and down about getting people vaccinated, and some of the political stones that have been thrown are not really for the benefit of the population as a whole. I just think that, we should all look for ways to protect ourselves from infectious disease and cooperate as much as possible.
David Loyer, thank you for joining us. We're so sorry for your loss, and thank you for sharing your story with us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.